basic fundamental anatomy of the liver organ, since all the alimentary system has been completed by the Dr. Mirza Uwais, but still as a glance we would like to see here, the liver is located on the diaphragm, just below the diaphragm. The liver is located, the diaphragm, it separates to the upper geo and then middle geo. In between there is a layer, that is the septum layer is there here. So that layer is bifurcate each other. But of course this is the liver is located on the right side and also located on the left side as well. Remember how the heart is located on the left side is the minimum is located on the right side as well. The right side having the pain, that also causing the problem in the chest pain is there, that also connected to the cardiac pain as well. The people says only related to the left side I do have the pain, indicating is the cardiac pain. Of course at the same time certain conditions, because the existing cardiac system, the cardia, levocardia, something is connected to the right side as well. So therefore on the left side is there more, right side is there more, also causing the heart attack and pain as well sometimes. In the similar way, this also on the left side also existing the liver system, because it is the gun shape. That's the reason I remembered the gun, K-G-A-N, gun. The pronunciation is K-A-N, kan, indicating by the Chinese terminology is the liver. But I recognize it in my mind. Of course this looks like a gun, so this is gun shoe, that is the back shoe point for the liver. So however this is the located on the both the sides are existing, but majorly on the right side, just below to the diaphragm, below on the nipple region, right? Now we look at about there are the 4 lobes are existing on the hepatic organ. The first is right lobe and left lobe, and another is caudate and caudate. There are the another 2 lobes, smaller lobes are existing. Totally there are the 4 lobes are existing on the liver organ. You look at about the liver, but it seems to be like a beetroot color, right? If you cut and see the beetroot, so that is totally it is kind of the red color, a brownish red color, indicating where the anemia is there, iron deficiency anemia, even leukemia conditions. Certainly the beetroot we call as a ABC juice, so that is really good for the health. At the same time the liver also it is the brownish and then dark brownish and red color, indicating that also stored the maximum amount of the liver blood. So in this you can look at about just below that there is the gallbladder also just located, and under that of course is the duodenum and then pancreas. Further it is connecting to the spleen as well. Now we look at about there is the biliary duct which I told you. So previous week, there is a liver having the right and then left lobe. There are the right lobe and then left lobe is communicating to the hepatic tubes or hepatic ducts. So both are joining together. When both are joining together is known as a common hepatic duct. And then when the gallbladder is you look at about the downwards part of the body is the bottom of the gallbladder, the center is the body of the gallbladder, the top of the gallbladder to be known as the neck of the gallbladder. So after the neck will become the bile duct, right? The bile or the cystic duct and then hepatic duct joining together, that is a common bile duct as well. So when this joining together, that reaching to the duodenum is the which part of the alimentary system? Yes, it is the part of the small intestine. So when small intestine it reaches, Through that it is communicating to the pancreas and also on the ileum jejunum as well. So now further it is communicating to the colon. So now anything there is the problem in the hepatic organ, there is any problem, the toxic substances are accumulated, that will be drained out through the this duct where the bile is excessive secretion is there. That time the bile is supplying to the storage in the gallbladder, that definitely moving to the duodenum. Whatever the toxins are there, the toxins comes from the portal vein as well. That is the nutrition. The good nutrition is come from the portal vein. There is a stomach, a small intestine and a large intestine, and then pancreas. All collectively the substances taken through the portal vein to the liver. Right? Hepatic cells are known as a liver cells, and then there are the another cells to be known as a Kupffer cells. Kupffer cells, hepatic cells are essential to regulate the mechanism of the liver system, whereas in the Kupffer cells, which is essential for the phagocytic function, that indicating anything toxic substances. For example, we consume so many things. What is required for us? For example, I do required as a 3 chapatis or the 3 dosas. Perhaps I take 5 dosas or maybe something more with a lot of other dishes together, then it is not required to the body. So whatever there is a excessive function, excessive accumulated, that certainly absorb whatever required the nutrition to our body system, remaining it goes to the hepatic system to storage. With the support of the insulin, the pancreas, it releases this hormone to be known as a insulin. The insulin takes the support by the liver, then that will convert in the form of the glucose into the glycogen, and then whenever we feel the fast or we don't get the food on time, we feel hungry. For example, I am fasting, during the fasting, but maybe I'm talking to you, teaching you, 2 o'clock I feel hungry, but I'll take the evening class till 6 o'clock, then without having my food I can continue my lecture, indicating that the glycogen convert in the form of the glucose to nourishing me to address to all of you. So in this way, whenever there is energy is required, but energy is given by the liver system, at the same time detoxification also taken place by the hepatic system as well. The major bile production and then excretion is the major physiology. You look at about when we have the good quality of the food is there, nearly I told you 500 ml to the 1 liter of the bile is secreted by the by the liver system per day. How many ml? Totally 1 liter. 1 liter of the bile is secreted, but at the same time storage in the gallbladder is how much? So only the nearly 50 ml, 40 cc to 50 cc will stored in the gallbladder. So therefore, whenever required, that is a concentrated form. There is where the liver is secreted, there is a mucus, there is a semi-solid, sticky and then watery form, but that will be concentrated in the liver gallbladder. That is required for the metabolism in generally. If the metabolism is not there or not doing metabolism in our abdominal organ, then you remember it is connected to the bile is not enough to do the digestion. Whatever we consume like carbs, proteins and fats to be converted in the form of the fat to fatty acids and amino acids and protein end product as urea, all are connected to this particular physiological aspect of the liver system. When the metabolism of the carbohydrates, fats and proteins to be taken place, whenever we consume the food, so that time, so most of the times when I think you understand now, very long ago I told you the reason to cause the diabetes, not only the Langerhans of the beta cells of the pancreas, but also it is connected to the stomach, it is connected to the spleen, it is connected to the liver, it is connected to the intestine, so on. So therefore now you understand, when they consume the rice, and that time the diabetes patient is not recommended to consume the rice much level, so that time here is metabolism metabolism of the carbohydrates to be taken place. You remember the fatty liver. Most of the fatty liver patients, fatty liver condition, they don't get the good digestion. Always they have the obesity patients. The obese is more, then it is indicating not only the cholesterol, of course so many things has been incorporated here, but carbs are metabolism to be taken place by the liver as well. That's the reason I made one video related to the liver, how to control the diabetes and hypertension together by activating the two acupuncture points that have the broad spectrum of the knowledge. You can have a look about it. And also breakdown of the digestion and defensive against the microbes. The breakdown of the digestion, whatever we consume, for example, we take the chapati sometimes, minimum, initially it is recommended to eat the food is very small quantities. Sometimes we take with the 3 fingers and then use it. The people use the forceps and then what we call as a small spoons, and they take it through that, even rice and so on. But with the 5 fingers, of course eating with the fingers, that produces the enzymes, that is the Indian culture. But however we take the maximum quantity and then we smash and then take it inside full of mouth, that's really not recommended. So that time if we take the chapatis, the little this much, then that is the larger quantity we are putting under the mouth, and the mastication to be taken place by the teeth. But by the way, we don't give that job to the teeth, but we give the job to the stomach and other organ. But that particular time, it's break down the digestion, the break down these larger particles to the very fine particles and the smaller particles also to be taken place by the liver system. At the same time, defensive against the that's called as the anabolism and then catabolism. The defensive against the microbes called as a phagocytosis function. There are the phagocytosis are existing on the throat, and also phagocytosis are existing in the manywhere in the body, but especially on the liver system as well. You look at about here, you look at about the vibrissae, this also phagocytosis function, where you look at about the eyelashes, that also phagocytic function. God has been created in the natural form to protect the eye system. So therefore it is the which is existing in the against the microbes, it works in the body. We consume good things, we consume very bad things and so on. So that time the people consume the chocolates and then ice creams and then bakery items, many things which is preservatives has been added in that time it leads to the hazards to the health condition. So that time we also uses the medicine. Sometimes you look at about the people who consume the lot of medicines, but that having the effective medicines, of course sometimes is ineffective medicines as well, right? So that kind of situation you understand when we take more enough amount of the food, so that goes and deposits in our body system somewhere which is not required. Medicine will stored in our body which is not required. So the alcohol is not required to our body, but we consume. Even today you look at about the whole globe, the people are consuming like a water they take less, and alcohol they are taking more as a liquid form. But this is in fact is very dangerous to our health. So that also will stored in the hepatic organ slowly, that also slowly will get the detoxifiers in our body system, right? It detoxifies at the same time we consume anything is the non-hygienic thing, and that will enter to our body system. Again, when the immunity system is good, immune power is good in our body, that also connected to the liver organ. When the immunity, that also connected to the lymphatic system, that is known as a spleen. Spleen is major role for the immunity. At the same time liver also is the one of the role. The thing is there that the foreign particles enter to in our body, that slowly and go study in the deposit in the hepatic organ. So there is, as I told you, the Kupffer cells. Hepatocytes are the liver cells. The liver cells releases the enzymes and also releases the bile and so on, whereas in Kupffer cells Kupffer cells will protect our body system. Whatever we consume, we take the microbes from the external environment that will go and deposit anywhere sometimes, that also detoxifies or it engulfs. It eats that bacteria, that cells. That's the reason God has been created the good cells and also the bad cells together to protect our body system. Then excretion of the bilirubin and then biliverdin, both are secreted by the hepatic organ stored in the gallbladder, and that also which is not required, the bilirubin at certain amount which is required, making the pigmentation to the urine, making the pigmentation as a green color, which is required to the hepatic organ, right? So that time when it is unwanted is there, that to be excreted through the renal system, through the kidneys. So whereas in detoxification of the drug and toxic substances, which already I told you, the storage of the iron, glycogen, fat soluble vitamins and vitamin B12. So storage of the iron. Now as I told you, there are the iron deficiency anemia, sickle cell anemia, leukemia, or the normocytic, normochromic anemia, so on. So anything that kind of the anemia is there, that means the storage, because of the liver is not producing enough blood and not synthesizing the enough blood. At the same time, there is no storage of the iron as well. At the same time, when the glycogen, which we wanted to treat for the iron elevation, then you remember we wanted to focus and treat to which organ? Liver also. Numerous organs are incorporated. When we wanted to talk about the spleen produces the white blood corpuscles and kidneys produces the red blood corpuscles and liver also produces the red blood corpuscles, so on, right? And also I told you the bone marrow is a very good information, where from the inside of the bone there are the cells are synthesized, that's called as a stem cells, stem cells in our body. So that is producing the whatever cells are required, the thrombocytes, lymphocytes, monocytes, neutrophils, eosinophils, basophils, so on. So whereas in it stores as a glycogen as well. Glycogen is nothing but is a glucose. Whatever I take, for example, I told you, so I had 2 chapatis this morning and also I had 1 dosa. Normally I don't take in that way. Today something is complimentary for me. So together, if we take as a 2 extra something that will stored in our, I required, how much I required? Even 1 chapati is enough to address to all of you. Why I wanted to eat 2 chapati and 1 dosa? Because to maintain my till 2 o'clock, so that I can maintain precisely without hungry, I am comfortable. Even I can eat even 1 more dosa or 1 more chapati, I can. But I don't want to take it because that will become dumping to my body system. Perhaps if I take more, so that is slowly go and stored in the form of the glycogen, not in the form of the glucose. Glucose is required for me to active. Then 1 chapati also quite enough, but 3 chapatis till 3 o'clock, it maintain my health without feeling hungry. That to be given by which organ? Come on. Liver. Good. Then the fat soluble vitamins, because we normally don't take non-veg, right? Yearly once we take the non-veg and all we are the vegetarian, right? So that's the reason this works well. But of course, even vegetarian food also people consume like so much oils. Numerous coconut oil, groundnut oil, sesame oil, then mustard oil, sunflower oil, so on, and they put lot of oils under that. But of course the quantity of the oil is very poor in that. But of course, if the namesake, it is so much oil is there. But that oil also to be considered as a fat oils itself. Even you take the non-veg, you don't take the non-veg, it doesn't matter. Sometimes the people use the oils through the non-veg and people use as a plant oils more. Sometimes this both are considered. But minimum quantity oil is required to our body system to moisturize and regulate. The people who don't consume the oils at all, that also leads to the dryness. I'll take only sukka chapati. Don't put, even sometimes I say to my wife, please don't put any oil, give it to me as a dry chapatis. Normally I say, when I look at about that, I feel no, I shouldn't eat something, I feel that. But if it is a very, very minimum, of course, that's required for the mobilization. You look at about the people who are constipated, then you understand it is not only the colon problem causing the, constipation, but where the bile is giving the lubrication to the colon. The digestive metabolism to be taken place when the person uses the small amount of the oil, that also in fact is required for the elevation of the lactic acid and also lubrication to be taken place in the colon. Now the fat soluble vitamins called as A, D, E, K. These are the vitamins certainly required to convert in the form of the water soluble vitamins, because this is the fat soluble that doesn't digest properly. Until it digests, because this is in the fat soluble vitamins are dissolved in the hepatic organ, in the liver system. And also vitamin B12 also it is stored. When the vitamin B12 deficiency, the most of the times we see, look at about the neuro related disorders or the neuron related disorders, neuropathic conditions, sometimes we feel that vitamin 12 having the deficiency. That particular time certainly the liver also major role to regulate the arterial system. Here